Hi all. So as promised, I would like to bring to you the dog mauling video. Um, the person in question will remain anonymous to protect the innocent and not so innocent. But I do want to say that dog owners in Israel are 100% responsible and liable for the behavior of their dogs. So if you are a dog owner, particularly if you've raised an attack dog or a dog to attack without a command, just at the dog's own sense, this is the sort of thing that can happen. I'm going to include a surveillance video of the actual attack. You can see that the dog was unprovoked. You can't actually see the dog in the video because the car is blocking him. But the dog was on a chain, and no one in this family, this was a family gathering, no one in the family was notified that this dog was an attack dog or had ever had a prior attack history, which in fact the dog did have. So, without further ado, pretty horrifying. Thankfully, the victim knew to call me right away within several minutes of the attack, and he was less than 15 minutes away from where I was, or from our house. So I advised him to wash the area with soap and water first. And there was a chunk of skin hanging out that was about an inch in diameter and had gone maybe 3/4 of an inch deep, that the victim could identify at the time. So when he washed it, that chunk of skin fell off, and then he got in the car and drove straight to me, where we first had a very similar protocol to what we do for the scorpion. But instead of removing venom, we are removing or trying to adsorb bacteria from the dog's mouth and get the area very clean. So I made a paste very quickly with activated charcoal to draw out the bacteria from the mouth of the dog that may have been in the wounds. I noticed that there were 2 wounds at that time, and then since then I've noticed that there were smaller wounds that I think were caused by claws, like up by the mouth. So just smaller wounds that you don't see so well. In fact, it took me a while with all the swelling and bruising. It took me a while to actually see these little pock marks. And then, of course, they became painful as we treated them going on. So I knew that they were, in fact, wounds. But at the time, I could only see 2 main wounds. And so seeing that the area had already been washed, I quickly made a paste of activated charcoal with yarrow tincture. I could have done this with a yarrow tea. I could have done it with other herbs. There are lots of other herbs. In fact, Inula viscosa may have been a choice herb that's available in this region. But yarrow is so well known for wounds of any kind. As I may have mentioned before, the Latin name is Achillea millefolium, and the Achillea is the Achilles heel, where basically this herb can protect your whole body. And, just like Achilles was impervious to injury except for the heel. Luckily, this wasn't on the heel, so I knew we were okay. Ha ha ha! Little herbalist humor for you. So I quickly made a paste with yarrow tincture and activated charcoal, and I spread that all over the wound. I ended up having to repeat this paste either 2 or 3 times over the next 24 hours. And you will see in the pictures as the cut heals, and I should warn you from here on out, it's fairly graphic. It begins with the shredded pants, which you'll see next, and then into real close-up pictures of the wound so you can see the healing process. But the black that you see, especially in the early pictures, and the blackening of the skin, I'm like touching my knee right now and you can't even see it, so that's not very helpful, but all of the blackening was really from the activated charcoal. And a lot of that activated charcoal really clung to the inside of the lacerations, the bites basically on the leg. And anyway, so that's what we did, was made a paste, let that sit for a while, and then as the charcoal started to dry out, just dropping more yarrow tincture, straight yarrow tincture, right on the activated charcoal to re-moisten it, and just wait again. And in the meanwhile, we used homeopathic arnica, which I've talked in the virtual plant walk about homeopathy. It's a different modality of healing, but also a very nice one. And calendula. So I had a calendula salve. I always have a calendula salve that I make on hand. This one was calendula oil and Anula viscosa and lavender oil and just different things that I made. I always have an all-purpose salve on hand that I make. Sometimes it's mint, like peppermint and lavender in calendula flowers. A lot of times there's lavender oil in there as well. But anyway, this one happened to have Anula viscosa, which in my mind was even better. So you'll see in the pictures that we spread the salve around the cut, and when I put it on, I would take the cut as the center, and I would spread the salve out almost like a sun away from the cut, because I didn't want to seal or trap any bacteria inside of the cut. I wanted it open to me. I believe this would have required stitches according to the Western medical model had we gone to the hospital immediately, to the hospital emergency room. And of course, at any time, we were prepared to do just that. So we're always looking for different warning signs. We're always looking to track healing and make sure healing is moving in the direction we expect it to move in. And in order to know what to expect, you'll need to do some research and do a bit of learning, but it's not so hard. You look up the process of cuts. And an interesting aside, I was a professional child actress, and I was actually reading a script to one of my children the other day in a show that I had done where I needed to make a lot of wounds on my body. And so as an actress, that's one of the things that I learned as a young child, was the process of wounds and bruising and how the discoloration looks over time. So those things are kind of always in my mind, even with pus and this sort of thing, how it moves. And, obviously when you're doing stage makeup, things, an older bruise looks different than a fresher bruise. So I study a lot of those pictures, and I still do out of habit, and also because I'm an herbalist and I work on first aid cases. So anyway, you'll notice kind of a shiny salve that's just kind of radiating out around the wound, but nothing on the direct wound. When we stopped doing the activated charcoal poultices, I would say I think he washed the leg after maybe an hour and a half, and then I think we may have done activated charcoal again, and then we may have then he washed it off the next morning. He slept in that, and then the next day we did again another poultice, I think later on in the day, just because I saw some pus forming in the deeper laceration, I guess I would say, bite mark. I don't know what's what to call it, yucky bad thing. So I saw some pussing there and some white kind of membranes, and I just wanted to make sure that we really, really had the bacteria out of the way while it was healing. So we did repeat the activated charcoal poultice a few times with yarrow, and I think maybe in the later poultices we may have used straight water, or I may have made a tea of something, but honestly, it's not so fresh in the mind anymore. And then we used that salve, and the salve was basically to treat bruising and the arnica, homeopathic arnica, against swelling and this sort of thing. Just to, these things are all normal body process, and it's okay. It's okay if there's swelling, and it's okay if there's pus and all of that. It's just signs for me to use certain herbs to deal with the problems along the way. So once that was done, our protocol every day was, at first, it was to just put drops of yarrow tincture on the wounds. And I was waiting, for me, a signal was when the wounds stopped burning, when I would put yarrow on. And then for me, that was a sign that the wound had fully closed up. So that's what I was waiting for. And that took a good week, maybe 8 days even for that to happen. So all during those days, I wanted to keep the wound open. Now, an herbalist that I love and trust very much, and actually consulted with through this, recommended steri strips. And that was something that I realized I probably should have on hand. But when she recommended it, it was the day after the injury. And when I went back to look at the injury, as you'll see, there was so much redness and swelling and there was so much hair because of where it was on his leg, that the idea of steri strips sounded to me like trauma all over again. Because obviously, and I hadn't known that then, but the dog had scratched around the bite marks. And so a few days later, when the swelling went down, the pock marks started showing up, and I put a drop of yarrow in those too, and those really, really burned our victim. So I'm glad I didn't use the steri strips, because I probably wouldn't have seen those smaller scratch marks. And perhaps I would have had, or perhaps there will be a more even scar, or would have been a more even scar with the steri strips. We're still in the process. I assume that there'll be a scar. I don't know. I would love it if there isn't. But things I use to help prevent a scar are lavender oil. You can mix essential oil and a carrier oil if you don't have lavender oil on hand. Vitamin E, calendula, and also nourishing herbal infusions. So we use nourishing herbal infusions, a mix of nettles, oat straw, and linden blossoms throughout the days, and lots of vitamin C, sodium ascorbate, along the way, to help regenerate tissue and just keep the immune system up. I would have sprinkled sodium ascorbate directly into the cut if I felt things kind of got out of hand, but they didn't, thank God. So the other thing we did was elderberry tincture. And again, those were just kind of immune boosting herbs. At one point, I found the need to use cleavers internally. I just wanted to move things through. I felt like things were kind of stagnant, and that was more of a feeling. I don't have like an exact point, like I can say I saw a certain thing and I knew I just felt it from looking at it and looking at the victim, that things were getting kind of stuck and maybe clogged up. And so I wanted to kind of open up that lymphatic system in the victim. What else? I did use hawthorn because this victim was, especially because it happened in his family, and because there was a lot of dishonesty and betrayal with not being forthright about the dog, and then also not taking responsibility for the dog. I employed hawthorn, I could have also used perhaps motherwort or some other herbs to kind of have a courageous heart for the victim who was in a lot of emotional pain over what happened, in addition to the physical pain. I'm trying to think if I forgot any herbs that we used. Sometimes I used a little bit of licorice root just as an activator, just a tiny, tiny bit. This victim actually has a history of high blood pressure. So typically high blood pressure is a contraindication for licorice root. And so I decided to use that very, very sparingly. So we're talking about maybe like 5 drops. And that happened maybe 2 days. I gave it maybe twice over the whole course of this injury, just because I felt that was indicated. I hope I'm not forgetting anything, but that was mostly it. And lots of reassurance, because the victim, also the hawthorn came in handy here. Hawthorn being for the heart. It can be literally for the heart, for heart problems, heart valve problems, this sort of thing, but it can also be for the emotional heart. And, this is another beautiful rose family. I just put up on the virtual plant walk today a video about brambles, about blackberry, where we talked about other rose family plants. If you want to learn more about that, red raspberry, blackberry, and strawberry were mentioned in those videos as well. So hawthorn is part of that family. And every time I say it, I put my hand on my heart instinctively. A lot of reassurance for the victim that it's going to be okay, that he wasn't in a critically, life or death situation, but also to make sure that it was clear that there were concerns, and this was a very serious bite, and in a very sensitive place. So that was a balance. And then as we moved through the process, you can see that the wound starts kind of stabbing over from the inside. I like to think of it as a zipper from the inside. So the wound was open like this, and it starts pulling together from the bottom and comes to the top. Now, when you first start pulling to get it really in, you see my thumb just kind of naturally goes out more. So actually, up by day 2, the top of the wound, the larger circular wound, looked a little bit more open and puffy and swollen, but I would have expected that. And then I'm not sure if I'm showing this right, but so here's the wound, and then just the bottom comes together, and the ends up here and here were just kind of puffing out, but they kind of zipped right up from the bottom. And warning signs I would have been looking for would have been abnormal behavior in the victim, excessive pain, any kind of redness or blackness that was extending from the wounds into into other parts of his leg. I was checking for pain every day, so I would feel around the leg, around the wound, and see how far the pain had extended, and I could see the movement where pain was extending. And another thing I saw was some scar tissue kind of coming to the surface above the longer laceration, which I understood to be from tissues deep inside that were just kind of coming up to the surface, because there weren't any actual cuts in that area. The kneecap hurt more, but for me that was more of an indication of the damage in the tissues underneath the wound and the extent of that damage. So I did expect some spreading. Also the natural endorphins, as they kind of wore off. More pain, more swelling, more bruising as time went on. But I was looking for old bruising versus new kind of bruising. So I was just looking for certain things that would follow a normal pattern for me, and anything that would have deviated from that normal pattern would have necessitated a trip to the Western medical model. So again, I am telling you what I did to help treat a very serious dog mauling. I am not telling you how to do it or that you should do it. As with the scorpion video, we do what we feel comfortable with as far as our health. It's important to be able to make choices. And if you feel that a dog mauling is out of your skill set, then and you feel more comfortable and safer seeking Western medical care, or hi honey, all the girls coming in, you should do that. That's the right thing for you. And if you are someone who's inclined to give things a whirl at home, you can also choose to be very proactive. I do. It's true. If you're here's Amelia. If you're choosing to be if you're choosing to be proactive yourself, then these are the steps that I took, and some of the steps that you may like to look into further in treating yourself. And just remember to be open and ready that if you need to seek help or additional care, that is also an avenue that's open to you as well. Looks like our video is done for now. Say bye, ladies. Bye. Hi, everybody. I just want to give you an update on the dog bite situation. I want to tell you that some things went wrong. And I want to tell you a little bit about what is my fault and what I take responsibility for, and the dangers that are inherent to anybody who practice healing arts in any way, but particularly those of us who don't have insurance and aren't recognized by our current society as having a valid skill set and all of this. So I want to address some of these in this video. And we're still in the thick of it, so we'll see how everything pans out. And it could be that my error isn't actually relevant and didn't actually cause any problems in this situation. But only once complications started happening did I consider anywhere I could possibly go wrong. Did I develop a new, more stringent take on things? So let's first say what happened. Day 9 after the attack, I had pictures up. You could see the progression, everything getting better, cleaner, healthier. By day 9, there was new pink skin over both of the bites, and the yarrow was no longer burning and hadn't been burning for a couple of days by then, a few days, when I would drop it into the actual lacerations. And so I was under the impression that the pink new skin I saw was healed, and the wound was now good and covered, and we were good. We didn't have to worry about a bacterial contamination. I was wrong. We do have to worry about a bacterial contamination, and I don't know if that's at play here, but I'll tell you a bit more about that. But I just want to say very, very clearly, I told the victim that beginning day 10, if he wanted, he could use just a little bit of the Anula viscosa salve right over the cuts as well to kind of help with tissue healing. It is possible that I'm going to change my, and you all know from the other video how absolutely careful I am and was about putting any oil-based anything on an open wound because it can trap bacteria, and a dog's mouth has tons of dangerous bacteria, and so I was extra vigilant about this particular wound. And seeing all of those things, I should have made a blanket policy in my mind to never, ever, ever use any oil-based salve on the wound, even when it had appeared healed, even when the skin, new pink skin had appeared, pain had stopped, oozing had stopped, bleeding had stopped, whatever, and it looked healed. I may say now not to use an oil-based salve over any wound that had ever been open at any time, ever. But anyway, so that's the first thing. Second thing is, after day 9, beginning on day 10, I really felt like we were out of the woods, things were good, and I turned everything over to the client, because until the victim in this situation, and until that point, I had been very involved in actually administering, the yarrow and the salve, and really talking through it the whole time, saying, here I'm using just 2 drops in this one and 1 drop here, and hold your leg here so it just holds on to the yarrow, and that's all you need, and saying things like, look, we're using just this tiny amount of salve on a Q-tip, because you want to use the least amount of salve necessary. Excuse me. And I thought I was being very clear by clearly outlining it. And when I told the victim that he could take over responsibility for the treatment beginning with day 10, I did give him specific instructions about just 1 to 2 drops in each one of those bites, the lacerations, and a very small amount of Inula viscosa, which could now actually go over the cut. And I was very surprised to find that within a few days, the bottle of yarrow tincture was empty, and the Inula viscosa salve had been completely utilized. So the victim was using way, way, way more of these medicines than I recommended. But of course, in this situation, people need to if people are using plant medicine or using any kind of anything, even Western medicine, we all need to take responsibility for the choices that we make. So one thing I want to say, this is not the first time that this has happened to me or any other person I know, any other healer I know, where specific instructions were given, oftentimes written down or typed out, but they weren't followed. My friends who are doctors in the Western medical model have the same thing. They call it non-compliance. So, there's not a lot we can do about that. We can just go over our communication skills and make sure that we clearly stated what needed to be done. And we said things like, do you have any questions? Are you clear about how much of this you need to use, or how often, or whatever? And I don't think we can really beat ourselves up about that as healers. At any rate, by about day 10 or 11, the victim reached out to me to say that there was a tremendous amount of itching in the area. And I asked, is this itching where the actual bites are? And I was told, yeah, and just my whole leg, it itches. I said, okay, well, but it's on the bites? Because if it's on the bites, then that would make sense to me, because there's probably some scabbing that's happening, and that would be normal. I have to add that at that time, I was coming down with an illness, and my kids, many children, were all sick, and I just needed to put my family first, and the children first, and the sick people first, and so I wasn't really able to do clear follow-up during these days. But at that point, I reassured the victim that everything should be fine, that itching happens when there's scabbing, and maybe scabs are starting to come off. I had seen a little bit of that happen on day 9, and itching could be normal. But then it was clear to me in the couple of days that followed that the itching was really getting worse, and it was all over the leg, and this wasn't normal. And when I finally got a good look at it, the leg was all around the knee, and now it had wrapped all the way around the entire knee joint, and up the thigh and a little bit down, and it was red and it was inflamed and it was almost leathery feeling, and the victim described it as bubbly feeling with just a huge amount of itching. So I tried to run through in my head what could have gone wrong. For me, initially, the fact that all of the yarrow tincture had been used made me think, okay, maybe so much yarrow and so much alcohol had dried out the tissues and whatever. At first I started thinking that, but as I started seeing into the next day, how it was more inflamed and just this weird kind of response that was a bit too much for that. And then I started thinking, okay, occasionally, I've seen people, myself included, that with annular viscosa, their bodies say no. All of a sudden they build up a huge, tolerance and or they exceed tolerance for it and then say no more, and there's some redness or swelling, and I thought, okay, maybe we're having an allergic reaction all of a sudden, or some kind of delayed allergic reaction. Again, the annular viscosa had been employed already for 2 weeks by this point with no reaction. So, but it does happen, and I have seen it. So I allowed for that possibility as well and shared that with the victim. But 24 to 48 hours into this, it was kind of over the span of 2 days where I really saw it, things just didn't look right. And for me, the final straw was when I looked, I saw some crusting around the bites, which I hadn't seen really when I was caring for it so intensively. And then I started seeing this kind of clear pus, or clear yellowish clear pus, and I said, okay, this isn't really not good, and sent the victim on to a Western medical doctor. I want to stop here and say that, and I said it in the video before and I say it over and over, if we feel that something's out of our skill set or has moved on to the next level, it's really important to be able to swallow your pride and send on and just know when you've hit that point. So I knew that I wanted another set of eyes on this, and was very grateful that Western medicine is available to be that second set of eyes. And unfortunately, when the victim went to the first doctor and explained to the first doctor what happened, because he looked and he said, "You were bitten by a dog and it's red and inflamed. Oh my gosh, you are going to end up with a leg amputation, and you have staph, and you're, in a life-threatening situation. You need to go to the emergency room right now." And then the victim, put me on the phone with this doctor who started saying "Oh, it's you hippie herbalist," whatever. Okay, so I'm trying to, I think maybe I need to clean the camera too. Hang on. Okay, so it's very, I still haven't totally mastered those relationships with people who are very hostile to herbal medicine, and just that kind of feeling you aren't a doctor, how dare you try and treat this yourself, and a man may have lost his leg because of you, and just all of this stuff, which was really just unfortunate. So I tried to explain that actually I have videos and photographic evidence to prove the progression for those original 9 days, and that things were improving and going very well. And I can assure the doctor that the wound was cleaned very, very well, probably much, much better than many Western medical model doctors would do. But And I say that because they rely a lot on antibiotics. Not all, but some really do, and not so much on wound cleaning. And you can see, you can Google that one. But I really tried to explain, and the doctor saying, "No, you don't understand. You don't know anything about this. This could be bad things." And I'm like a bacterial infection. And he's like, "You don't understand. Why do you even say things like this when you don't even know what bacterial means?" And I'm going, okay. So when we start getting into that situation, there really isn't a lot to say except thank you so much for your help and your advice. The victim decided to go to the doctor the next morning. And the other doctor is a friend of mine who actually knows me well, and so thankfully there wasn't a personal attack on my character. And of course, I highly recommended her to the victim, to go to and really get that second opinion. And so, I offered to her through the victim, any of the pictures I had taken or a video or anything else, so she could see the progression. And she said, "Listen, I'm not really sure what's going on. Usually, like for us, the protocol is dog bite, red inflamed. Next step is antibiotics, and but this is 2 weeks after the bite." That I understand was cleaned very, very thoroughly. So, and was progressing very nicely, and then suddenly everything turned. So the idea that this is an allergic reaction seems to me to be very possible. And if that's what Rivkah thinks, then, here's an antihistamine that you can try. And in the case that there's some bacterial infection that's happened, for whatever reason, here's some antibiotics, and you can, try the antihistamine first and then move on to antibiotics if you see that things are spreading. And she drew a line around the common practice with doctors to draw a line around the actual inflammation and swelling, and said, listen, if it's growing and expanding, you need to go onto the antibiotics. And if not, and it remains localized or starts to decrease, then it might just be an allergic reaction and be okay. So that's the phase that we're in right now. But I can say that as I saw the injury again after this doctor's appointment, and I saw again that kind of clear yellowish pus. It's clear, but it's like I should say secretion. I'm suspecting it's a type of pus, but it's a secretion. And this kind of crusting, just the way it looks to me, my feeling now, after seeing it a few days after it began, is there's something bacterial going on. And so that was when it was like, I'm going like, but it can't be, because the wound was cleaned so thoroughly. There's no way this could happen from the dog's mouth. And then I went, oh my gosh. I told him he could use the Anula viscosa salve right over the wound, and that would have trapped in bacteria. So 100% responsibility for that bad move on my part, and I learned a lot about what I'm going to advise regarding salves at any time in healing. And I can't prove whether or not, I'm still waiting to hear about how that antihistamine worked out and what the progress is so far. It's very possible it was an allergic reaction and that's all we're dealing with, but my feeling is that we really have to consider a bacterial infection and consider that it was a different bacteria that got trapped in about 10 days after the attack, not something that was originally in the dog's mouth. So I will keep you posted. Okay, I'm going to try this video again, another update about the dog mauling. It's hard to leave a video when there are little children underfoot, and also I misspoke in the last video and said the exact opposite of what I meant to say. But to continue the story, we're about a month in. The victim did eventually get a second opinion, go to a doctor who actually knew me, and thankfully took my thoughts into consideration, which made for a much more pleasant appointment. And it's so important that we as herbalists and practitioners and healers have good relationships with the Western medical model and good relationships with those from that modality of healing. At any rate, the doctor decided with the victim that perhaps it was an allergic reaction to the Inula viscosa, and she gave him an antihistamine pill and said that he can try this if he would like. And if it works, then it's an allergic reaction. And they drew a line around the victim's leg with marker. And she said that if the swelling and redness extends beyond the borders of that line that they've drawn, then she strongly recommends he begin the antibiotic. So the victim did decide to take the antihistamine about a day later as things were intensifying for the victim, sadly. And immediately within 15-20 minutes after taking the antihistamine, I hope I said antihistamine because I said antibiotic in the other video and that wasn't the case. Take the antihistamine first. About 15 to 20 minutes after taking this antihistamine, the victim had diarrhea, nausea, and dizziness, pretty severe, and wasn't, just had to rest for the rest of the evening. And the following day, all of the redness and swelling was gone. So the victim was supposed to be taking that on a daily basis, the antihistamine once a day at bedtime, but decided after the severe side effects of that particular pharmaceutical that he was not going to take it anymore. And of course decided not to take an antibiotic at all because he saw that everything seemed fine. But after about 24 hours after taking the antihistamine, the swelling and redness came back. The victim came to me again and said, I don't want to take any more antihistamine. I don't want to take the antibiotic. What can we do now? And I told him that I felt that one of two things was happening. Either there really was some bacteria that had gotten caught into the bites when the salve was applied over the bites, and my mistake, I thought that the bites were totally healed, but perhaps they weren't. We'll never know. Or it was really just an allergic reaction, in which case only time will tell. But I recommended, to be on the safe side, to return to a couple of charcoal poultices and to continue again with the 1 drop of yarrow in each of the 2 bites, 2 to 3 times a day. So the victim did 2 charcoal poultices over the course of 2 days, 1 on each day, and I'm happy to report that all the redness and swelling disappeared after that permanently. And then the victim has continued with the 1 drop of yarrow in each one of the bites. The lacerations seem to be healing up very nicely, but they are still oozy with a clear fluid that is crusting and creating scabbing, which I think is the best we could hope for. And the pain is gone, redness is gone, swelling's gone. So we seem to be moving in a good general direction, and I'm going to continue to take photographs, if not daily, then however frequently I can, and I will be adding them to this video as usual. Hello. This is June 26th, and the dog mauling took place on May 21st, so we are now over a month in. The victim, as you'll see from some of these pictures, went from a nice, after this situation with the allergic reaction, went into a situation with a lot of itchiness but no inflammation, and a change and a seepiness again to the bites. And I was mystified. So I kept suggesting to go with the yarrow, and that was one drop once a day. And as I kept seeing the itching and the flaking and kind of looking at it, I started saying, this looks like a fungal infection to me. Is it possible that you have a fungal infection? And the victim said, no, I don't have any fungal infection. 2 days later, the victim came to me to show me ringworm about a foot away from the bites on another part of his leg. So we changed the protocol at that point to powdered golden seal and applied the powdered golden seal to the ooziness that was happening around the bites, and thankfully that cleared up within about 24 hours once we had a handle on it. And as you can see, immediately completely covered up, stopped seeping, weeping, however you like to call it, and completely scabbed over. So that's where we are now. And here we end the dog mauling video. We're almost at exactly 2 months post attack. And as you can see, our victim is still healing. He still has a lot of healing to do, but he's come a long way. In summary, I just want to remind dog owners that it is your responsibility to train your dogs. And if you have been unable to have total command and total control over your dogs, it's your responsibility to have them locked away so that they cannot hurt people like this. This attack, as you saw from the surveillance video, was probably 2 to 3 seconds in duration. But this victim has had quite a long ride these past 2 months, and it continues. This victim luckily had a very attentive herbalist, yours truly, to take pictures and constantly check in. Not everybody has that. This victim saw 2 different doctors. One who had basically convinced him that he was going to have an amputation and lose his leg, and told him to rush to the emergency room, where the victim then needed to be treated for shock, terror, fear with other herbs to deal with that interaction. Just because the victim chose to go a non-Western medical model route for healing this dog bite, and was exposed to that kind of treatment by one doctor in the Western medical model. And then I want to commend the second doctor, who took a very balanced, level-headed, non-biased against herbalists approach, used her eyes and her skills set to evaluate what was going on and to ask some of those questions that unfortunately the first doctor was not willing to ask because of his prejudice and bias against herbal medicine. Happily, this victim never needed to use pharmaceuticals outside of the one antihistamine that he took on that first day, but of course had negative unintended side effects of the nausea and diarrhea and all of that. But he did realize that it was the redness and swelling was responsive to an antihistamine, so likely an allergic reaction. I'll never be totally sold on that, for one reason, because I'm always looking to blame myself or try to improve myself or find any errors or ways I could have changed what I did as a healer. And so I always have to leave the possibility open that there was, in fact, a bacterial infection that occurred from putting an oil-based salve over a wound that I thought was healed, but it wasn't. I don't think I would say to never use an oil-based salve on anything that had ever been opened, which I think I had said in the previous video. At this point, I think I would really just exercise caution and not use any salve right on top of a wound until the wound had completely healed so that it was gone. And if that piece of skin had been injured later at a future date, then of course you could use the salve, provided it wasn't an open wound, but that's something, I guess, for another video. So happily, this victim, outside of that one antihistamine, did not choose to use any pharmaceutical drugs, even though he was prescribed them, but he was prescribed them by a doctor who said, I respect your desire to try and stay away from pharmaceuticals. So here's the antibiotic prescription in your pocket. Here's the antihistamine prescription in your pocket. If X, Y, and Z happens, then, my advice is to move on to that. Again, very balanced, level-headed, and I'm very grateful for my loving, mutually respectful partnerships that I have developed and I am developing among people with a very different paradigm and a very different modality for healing. And I appreciate those doctors and nurses and Western medical model trained personnel really bending in, leaning into something that's very far out of their paradigm to learn more about it. And I've met many wonderful such practitioners. So I want to commend them. And again, stress the importance of us working together, even though we may not believe in the other or believe in what the other is doing or think it's the best approach or, follows the Hippocratic Oath or whatever. We need to reach across those borders, and we need to understand that we all need each other. And we're better together when we work together than we are when we stand apart. Not that there's not room for opposition. Speak your mind. But for those who are willing to listen on both sides, let's see if we can join hands across the borders and try and respect a patient's individual rights and freedoms to choose how they want to care for their bodies, how they want to do the mitzvah of guarding their health. Let's do it. Let's be respectful of each person. At any rate, train your dogs. And I hope that you never have to deal with a dog mauling like this. Thank you for watching this whole documentary on the dog mauling. We had a lot of interesting and fun things like that fungal infection come up. Always be aware that, there's, I know in the Western medical model, sometimes we're taught to look for the, worst case scenario, but sometimes really weird stuff comes up, like a random ringworm fungal infection, that gets into an open and healing dog mulling wound, but, be able to roll with it, as an herbalist, as a practitioner, be able to roll with it, be able to adjust, be able to pivot as I was told by a very wise lady. Keep your eyes open, trust your gut, and let's help heal each other and the world. This has been Rivkah Asoulin for Ancient Roots Israel. Thanks for watching.